uko quarantine sometimes. Sasa German Shepherd inafanya ulisemaje sasa dog bana? But anyway, it's okay. Okay, yeah. So we can start this discussion. Dixon, how are you?
Fine, thank you.
So maybe you first introduce yourself, and then we go to the topic of discussion. The topic of discussion is about stimulus package and the president's speech today, as well as anyone who wants to join this conversation. You can use the link, join, or you can actually comment or give your perspective. So Dixon, introduce yourself and then we go to this.
Okay, thank you, Patrick. My name is Dixon Arwasa. I'm an ICU nurse from I work for the government. Yeah, in Nakuru County.
Yeah, good. So Dixon, maybe first we will start with what do you make of the president's speech today?
Okay, at least today the president's speech, I listened to it until he finished. Today his speech was at least good for us, especially as health workers, because at some time he mentioned about issues of health workers, especially as we fight with this pandemic. So I think the president was considerate on issues of health workers, and I think he is sensitive about the health system at this moment, maybe because the situation is escalating. So I think he has realized that he needs to take all measures, even to involve the health workers and the health system as a whole, so that we can be able to fight this pandemic.
Okay. Good. You know, the president, okay, when it comes maybe to healthcare workers, what is the most important thing are you guys looking? Especially for union and members, associations?
Okay, I would like to highlight on the various functions of these two bodies you mentioned. That is the association, the Nurses Association, and the Nurses Union. So for the union, usually it is about labor issues. This involves issues of remuneration. So mainly that is what the union does on the welfare of the nurses of this country. Then when we come to the association, we have two associations in this country: the Kenya Progressive Nurses Association, where personally I belong, and then we have the National Nurses Association. So these are the two associations we have in the country. For the associations, they are usual professional bodies. So they deal with the issues dealing with professionalism, that is for the nurses. Then when there are issues of professionalism, especially at the workplace, they intervene. The association also has a lawyer in case issues come up about the professionalism concerning the nurses at their workplace. They intervene through the law, and of course the law which governs the nurses practice, which is Cap 257 of the laws of Kenya. So those are the those are the functions of the two bodies, the associations and the union. So like now, the association can intervene, especially now that in this pandemic, it can intervene to talk to the authorities about the welfare of the nurses, because it is a professional thing. But then, like now, the association will focus on issues of the practice, how nurses are working on the ground, their issues. Then the emphasis is made by the union, whereby the union will follow up issues of remuneration, like now maybe the extra payment of making the nurses work better, or because of the conditions we are exposed to. So issues of compensation, issues of an extra pay as a as an encouragement come in, and especially for the union specifically.
Okay, good. So maybe since you are talking about compensation, and maybe in this difficult time when we have COVID-19 crisis, we saw Alfred Mutua seemed to be really awarding his medics in his county. Is this the same formula the government looks to adopt?
Okay, yeah, I think this is the same thing the government wants to adopt, because if you look across the globe, at the moment, if we take an example of America, when the pandemic started taking toll in America, the first thing the government did is to give some extra pay for the health workers. Then, if we come to Ghana, um, Ghana reduced all the taxes that are being deducted from the nurses or the health workers. So you can see that this thing has happened elsewhere in the world. So definitely, it has to happen in Kenya, because, for example, you are a health worker. When you go to the your workplace, especially those ones who are located in the isolation wards where we manage the uh, coronavirus patients, we are exposed to risk. Another thing, we work under very, very severe conditions. Like now, it is not easy to be in that to don in that gown. You can't stay with it even for 1 hour. It's not easy to stay with in that gown when you've donned. So it changes your life completely. And if it changes your life, then that means someone has to give you something, so that at least you can be comfortable, even when you work there. Then at home, you get that some family members are not comfortable staying with you. When you go back home, you can be given your own seat somewhere in the corner. Uh, if you have a cough, you can't cough freely, because they'll see now this person has come with the virus into the house. So we face a lot of challenges, and that is why the government needs to give us something extra, so that we can be encouraged to work better. So I think that is the direction the government is taking. If I can talk further, like in his speech, the president today talked about a welfare package to caution frontline officers who are fighting COVID-19. Definitely, this is where the health workers fall, and we are heading there. So I think the government is emulating what Mutua did, and I want to congratulate the governor Mutua, because all along he has been consistent in appreciating the work health workers do. This is not the first time he's doing it.
Okay.
So I think that is where the government is heading to.
Okay, good. So I would like to bring Wekesa. Wekesa is Mutua is his governor. So Mutua, Wekesa, maybe first introduce yourself, and then we'll push this conversation.
Yes, my names have not changed since the last 24 hours. I'm Wekesa Eric. Masaku, Vantuva Masaku.
Good, good.
Yes.
All right. So I want to maybe to bring you to speed in this conversation. We just started talking about what the president, or the government is doing, and especially when it comes to welfare of healthcare workers, and it seems to actually adopt the formula Mutua was using. What do you have to say, since now Mutua is your governor and it seems he was ahead of time?
I didn't get the whole speech of the president. Maybe I will see it, but since you are telling me they adopted, I'm assuming they are using the same strategy. Maybe I will check the news. But if at all they are impressing the idea of giving medical practitioners risk allowance and incentives, it's a good idea. It's a noble cause, because these are our first line of defense, and most of the time they have been even championing for salary increment and what, but it doesn't happen. Now, in moments like this, why don't you even show that you care about them? Why should it be a worry for you to increase the salary of a medical practitioner, but still use the same funds on doing other activities which may not be related to combating the epidemic? First of all, if our medical practitioners are well taken care of, then we are confident in terms of handling this issue.
Okay.
You see, when most of the, like when the US military goes to war, first of all, they ensure that their families are taken care of before even they leave.
Okay.
And you know, this is a biological war. You can win it, or you can also be affected by it. Yeah.
Okay. Good. Yeah, Dixon. Of course, Wakesa is bringing that we are in a war right now, and we are in the middle of a war. But I want to maybe to get your perspective when the president was talking about welfare for vulnerable groups, which are now people within Nairobi. They are saying they have identified those people who are very vulnerable. All right, so maybe lost Dixon. So, Wekesa, maybe you're saying you haven't seen the speech, but the president was saying about he has actually they have identified vulnerable groups in Nairobi, especially. Let me bring Dixon. So, Dixon, sorry, I had lost you.
Yeah, the network misbehaved a bit.
Okay. So this question, I'll first start with you, and then it goes the same to Wekesa. So the president said he has they have identified some vulnerable groups in Nairobi, or those people who need a package for survival, that they already started maybe sending stimulus money to them. What do you make of this, and how prudent can this be achieved?
Okay, that is a welcome idea, because the truth is, I think we've talked about this previously, that most of the middle class employees lost their jobs, and they don't have a source of income at the moment. They can't buy food, they can't pay for their rent. Some of them are stranded in towns, and they can't even have fare to travel. So I think this is a very good idea that the president has thought of, and it is going to help a lot. However, I don't know the criteria that the government was using to identify the needy people, but I believe it is going to work out. Now that several organizations have come up with to give a kit for assistance, so I think this is a good idea for especially those ones who are needy. And because most of the people at the moment are not able even to provide food in their houses. So I congratulate the government for that.
Okay. Good. Wekesa, you've had Dixon. What's your perspective on the same?
Yeah, identification is a good thing, but the devil is in the details. Huh? Like what Dixon has said is the criteria. You will find that they will say they have identified the needy people, but most of the time after this thing being done, you realize most families are still claiming they have not been reached. For me, I will say the first classification of identify needy people is the clusters. You don't tell me that they are. I think when you focus to help, if you focus on Mathare, please help every household in Mathare. If you focus on Kibera, help every household in Kibera, because this need does not sometimes don't project out. Just as somebody who has money doesn't show that he has money. Sometimes those who look convincingly like they have money actually are strugglers. They are just standing out and just putting on an image to fight their own struggles. And there are people who look like, let me give you an example. There was a time I was in Turkana district. And yes, so there are times when you meet Turkanas struggling and some of them dying of hunger. But when you go and check, some of them, they still have a herd of, they have sheep, and it's because of their culture. Some of them believe that you don't have to slaughter your animals and eat because of hunger. So they wait for those which die, and then they use them for they can but they want to preserve their animals even when they are struggling and dying of hunger.
Okay.
I'm saying this like there are people even who look like they don't have money but they have, and there are those who look like they have but they don't have. They are struggling. That's why when you go to a mat and you are seated, maybe the guy who looks very smart with a suit may be the guy who will rob you. You may not know that he's a robber. So for me, I would say that let them, especially they begin with the suburbs. Let every family get a share of the government supplements. Maybe to the extreme of those identified needy cases, let them do extra. But generally, most of these families in the suburbs have been affected.
Okay, good. So, Dixon, we are in a global pandemic, and we really want to maybe to bring our efforts together to actually defeat this crisis. Now, the question is, we saw what maybe Trump did. He withdrew the support for World Health Organization. And we know as Africans, we actually depend a lot for his support in terms of maybe diseases like Ebola, malaria, even other like HIV, all those diseases. But if he actually withdrawing funds, what these mean to Africa and especially Kenya?
Okay, thanks so much. I'll look at these in two perspectives. One is about the effect it is going to have in Africa, including Kenya. And I'll also associate it with the trends of the spread of this pandemic, this coronavirus in Africa. Now, I'll start with the effects of the withdrawal of the funding. The truth is, America gives a bigger share to the World Health Organization, and it really supports the World Body for Health. Now, I think it is going to affect the activities of the World Health Organization which will affect also us here in Kenya, because you realize sometimes, the World Health Organization involves itself in several activities so that they monitor such a crisis that we have at the moment. So I'm sure the activities that they get involved in are going to be affected directly. That means even the support they give, the monetary support and other support to the whole world, including Kenya, is going to be affected. And this means that we are going to have a very big burden to handle the situation in our country. And I think this should be a wake-up call to our government, so that we a bit get independent. And I think the direction we're heading, because now you realize the JQuat students who came up with uh, uh, the
Prototype.
machine for helping the ventilator. That was nice. You realize some of the factories are coming up to make the masks and other things. You realize the president has today come up with a kit to help the people who are affected with the pandemic. Again, is also focusing on health so much. Today's speech really talked about health issues, whereby he talked about the frontline fighters, that is the health workers. So somehow, I think the president and the government has realized that we need to take measures as the government, so that in case we get affected by the withdrawal of the funding to the World Health Organization, we'll be in a better position to fight these crises.
Okay.
Then I said I was talking about the pattern in which the the coronavirus is spreading in the country. I have followed in the media since yesterday, and some people are arguing that we should not put the measures that the other countries have put, like now total lockdown, such measures, so that we can curb the spread of the virus. Again, if we put such measures, for example, some countries, you realize they were supplying food to their people in their houses, which I'm very sure with our economy, which is not stable in Kenya, we can't be able to do that.
Yeah.
So now that the support is being withdrawn, then that calls for us to put measures which will be a bit friendly, because economically we are already affected as we talk now.
Okay.
So we can put measures in relation to the withdrawal of the support to the World Health Organization, knowing that even if we put those measures, we are not going to be affected completely
Okay.
economically in the country, and we are not going to affect those people who can't afford some of the services in the
Okay.
country.
Good. Good. Wekesa, in relation maybe to World Health Organization, but now I want us to vuke border, twende Tanzania. The Tanzanians actually started this whole social distancing with some interesting ways. They were not maybe adhering to all those measures, and actually their borders were open. But in a day, they recorded almost 35 cases. Now they are at 88. And now Magufuli said from tomorrow they want to have a 3-day prayers. Are prayers going to save Tanzania, or they did a big mistake?
Me, I'll say Magufuli and Trump are running away from the reality. When we started, people celebrated prematurely that other nations have locked their countries, and but Tanzania is continuing with the prayers and normal activities are going on. It appears Magufuli depends more on God. And yesterday I talked something on social media which rubbed people in the wrong way. I was talking about faith is not equal to foolishness. There is faith, and there is what you need to use as reasoning. God gave you both the heart and also the brain. So there are things you need to reason out, and there are things you need to commit them to God. And the things that He has put within your disposal and knowledge, you should not turn them to Him for Him to do it. You can actually do it. It's like, can you imagine you going and sitting on the table where there is food, and you pray that the Holy Spirit takes the food from the plate and put it in your mouth? You see, you just need to pick it with your hand. There are things that cannot happen, even if it's nothing is impossible with God, but there are things that need your practical actions. And so when we talked about social distancing was actually prescribed for the whole world, not on a particular country. But these are the recommendations that were given by WHO that every country was supposed to ratify, so that based on what they had seen happen in Wuhan as the first casualties, if we implement those measures, we are more safe.
Yeah.
But now, if you have not gone through that experience and you just come up with your own modalities or the ways of doing things, you realize that you may run into trouble, and people will quickly say situlikwambia. So the idea of faith is important, and most of us, we are very spiritual, but we understand also the practical measures that human beings need to do so that we live in a common world, that things happen to common people. We live in a world where those who go to church and those who don't go to church still experience rain. So there are things that are common to men, and we need all of us, despite of our faith, to adhere to the rules that are common to us all. And this virus is not selecting. The other day, they had just shown, I think it was Citizen, which was capturing a bishop who had said that God is bigger than coronavirus, had passed on. It may not look well from the way they have framed it, but the message is simple, that you don't neglect the fact that you have prayed that God will help you. Doesn't give you, as a driver, it doesn't give you a license to drive carelessly. If you have prayed that it will not, this thing should not, the robber should not come to your house, it doesn't mean now you leave your door open.
Okay.
So there are things that practically Tanzania ignored. And yesterday, it was, they had increased by 14. Now today, they increased by 35. I said it and I repeat it here, that the reason why the numbers of Tanzania remained low is because they did not early enough venture into massive screening. But
Okay.
if they started massive screening at the right time, we would be we will be in the same range.
Okay, good. Dixon, maybe when we talk about masks, especially for healthcare workers, and also when we talk about PPEs, first of all, have you received free of those items from the government? Number two, it seems like Joho was actually giving masks to police, and there was a lot. It was a big consignment, but I've not seen the same replicating to other counties. What are we missing, and Joho is getting right?
Okay, I think we are experiencing the effects of devolution especially when it comes to the health sector. I believe if we had we were in the national government, we could not be seeing this count doing this, another doing that. These things could be happening uniformly in the whole country. Now, you can realize that Joe is one of the governors who is really working hard to make sure that he controls the spread of this virus.
Yeah.
So, as much as he does that, the truth is, in other parts of this country, even in my own county,
Yeah.
we've not received such large consignments of PPEs and masks. I'm fearing the trend we are going to, because everyone has decided to pick any material and make masks, which is so dangerous. And last time when we were talking, I talked about this, that this is going to worsen the situation since the government has not taken measures on the same. Actually, at the moment, we are even struggling in our hospitals. We are struggling to get the masks. You are given a mask per day, and you are supposed to use it the whole day. They, they give a certain number of masks. If you get late, you are not going to get it. So this means there is a big shortage, as much as some factories have decided to make some masks. And again, the masks are expensive. So for Joe, it is a good thing he's doing, because he is considerate for those people who not afford to buy masks. In my town at the moment, you remember the law that was passed, that if you are found without a mask in public, you are going to pay a fine of 20,000 Kenyan shillings.
Yeah.
Unfortunately, even in my own town at the moment, you find several people walking without masks. So possibly these people are not able to afford the masks. I believe it will be prudent for the government to be able to provide free masks, just like Joe has done in his county.
Okay, good. Wekesa, are you there? Wekesa? Wekesa? All right, maybe Wekesa is not there yet now. So, Dixon, I'll move to what you saw maybe happening with Governor Sonko. Sonko said maybe by use of alcohol or maybe whiskey, yeah, it's going to have some positive effects on those citizens. So in every package he was giving the goods he was giving to citizens, he was actually including whiskey in it. Now, so are we missing? And I have not seen Sonko giving actually masks or PPEs to healthcare workers. So why is this? There's no focus to medics, maybe to people, and also including whiskey.
Okay, I think COVID-19 is a very new disease in the whole world.
Yeah.
And we are yet to discover a lot of things. Researches are being done, theories are coming up. So everyone is suggesting their own things. Like now, there is some elders from the coast region
Yeah.
who were advising their people that swimming in the Indian Ocean can help someone not to contact the virus.
Yeah.
I was reading today in an article that someone has come up with. He's a doctor. He has written a document that explains about the management of coronavirus. He was saying that he was thinking about how the lung takes in oxygen, and he was explaining about how people who live at high altitude areas they don't contact the virus easily, and even if they contact the virus, they are not so much affected. They don't lack oxygen so much like those people who live in lowlands. So what I'm trying to say is that people are coming up with so many theories. So I think Sonko also has come with his own theory that alcohol can help prevent the one from contacting the virus. One thing I would like to say is that, like now, one is encouraged to be taking a lot of water because the virus stays in the throat before it descends into the lungs. So people are encouraged to take water. We can't prove these things scientifically, but those are just ideas that if you take a lot of water, it is going to wash the virus down to your gut, and maybe it doesn't increase in your throat, so that some spread into the lungs. Uh, so Salk has one of his own theory again, but it can't be proved scientifically.
Okay, good. So, Dixon, maybe now the question is maybe going forward. I think in Kenya we haven't seen maybe a serious kind of curve that is coming. Going forward, what are we looking maybe for citizens to contribute so that we don't have a very serious curve in Kenya like other countries?
Um, I think the first thing is we take measures as citizens of this country. We avoid behaviors that promote the spread of the virus, like now gatherings. People are still using hard cash in making payments. People are still gathering in drinking dens. If you go to the towns, like in the stages, at the stages where people take matatus, people are still overcrowding. I think if we change our behavior, first of all, we are going to prevent the spread of the virus. Then one other thing is the government needs to increase its measures. It should be strict in emphasizing about the distancing. Again, we had an issue of people using substandard masks. I think this is where the government uh, is missing a lot because they've not decided to take measures and put a standard way of making the masks. Again, this is going to affect us terribly. But again, another theory which has not been proven is about our immunity. The curve is not increasing so much, possibly because of the immunity. This has not been done research, but if we relate with the before, just before the coronavirus was discovered in the country, you realize there were so many cases of pneumonia which were treated.
Yeah.
And this is where you find like the young kid who died in at Kenyatta. The kid was being treated for pneumonia, severe pneumonia. That is why the kid ended up in the ICU.
Yeah.
So there was an upsurge of pneumonia cases. There is a remote theory that several people could be having this virus, and people have healed without knowing that they had the virus. But I can't prove this scientifically.
Okay.
Again, if I relate with that, still there is I was talking to my friend in the US who is a nurse. He works with these patients. He was telling me that he thinks the same because uh, sometimes back about 3 weeks ago, he had a flu, which is not normal,
Okay.
and eventually healed. So he was also thinking that maybe if your immunity is good, then you are going to fight the virus. I want to relate this with with the common cold. It is one of the viruses that we have, and it doesn't have any treatment. This virus, when it attacks you, for example, if it attacks someone who has a a comorbidity like diabetes, they get affected so much, they get so sick. But if you are well, you don't have any other disease, you heal very fast. So possibly we can say that if we still tell people to eat health, maybe this can also help curb the virus.
Okay, good. That's an interesting take. Wekesa, I want to come to you. Can you turn on your mic, Wekesa?
Yes.
All right. You have had the interesting path Dixon has taken, but I want to come to you in terms of I talk also with people who have the same with Dixon, especially the Dick. They are saying maybe if we use our herbs, we have they're using lemon or using, I think, some concoction. There's high probability or high chances that we can actually naturally cure this virus. What is your ordinary person kind of maybe thinking? Wekesa?
Yeah. You know, one of the things we have been told so much is to avoid information that we get on social media. I don't want to be a case study. But anyway, I think we are working with a probability that perhaps our herbs are good. But for me, I will take it from this nutritional angle. That if you are able to eat food that it boosts your immune system, then chances are that you are bettering your body in terms of response to any disease that can attack it. Because one of the things that we have seen happening, most of the people who have been overwhelmed with this virus are people who have pre-existing conditions and who are suffering from other challenges. And you see, pre-existing conditions also they weaken your immune system because your body is already fighting with other conditions. So if you add another condition, it becomes overwhelmed. But if we eat healthy, in terms most of the virus, if borrowing from the flu virus, how we deal with the flu is you need to take plenty of water, then you take a lot of vegetables, fruits, like that, and with the time you find you have dealt with the virus or the causative agent from your body. So for most of the diseases where we don't have a remedy or a cure, we boost our immune so that we can have that natural response from the body dealing with that causative agent.
Okay.
So our herbs are known to be immune boosters. So you can never be wrong with our herbs. Not only for COVID-19, but any other disease response, you are just equipping your body for functionality.
Okay, good. I'll come to Dixon. Dixon, okay, let me unmute your mic. Okay. Can you try to unmute from your side, Dixon? Your mic? Okay, not working. I don't know why. Yeah. So before I unmute Dixon's mic, which has it's good now. Dixon, you can hear me now?
Yeah, I can hear you.
Good. So Dixon, maybe when we talk about nutrition, the issue becomes the cost. especially when we talk with nutritionists or even when we look at our markets, these vegetables or these um, fruits that maybe are meant to boost our immune system, most of the time in our supermarkets, they tend to be a bit expensive. Is it time now the government to reconsider and actually maybe give some tax breaks for agriculture and especially those producing vegetables and fruits?
Okay, I think last time when we were talking about the same, the same thing came when we were discussing about prevention of this virus. Um, I remember saying that some countries, I stay in a town where we have companies which are producing fresh fruits, fresh vegetables, and they export them to other countries. So at the moment, they have a very big market, and they are exporting a lot of produce from their farms. So I think people have come to realize that if you eat fresh food, it boosts immunity, and that is a fact. That is a fact. It's not about going to research about it. Researchers have proved that. Now, with our
Just continue.
Kenya, as you said, most of the food is very. You getting me?
Yeah, I can get you. Proceed. Yeah, I can.
Sorry for the
It's
interruption.
okay.
So I was saying that usual the prices of most of the products is influenced by uh, prices of fuel. Is one of the factors because uh, fuel is one of the things that is used most in producing and transporting food. Now that the government reduced the prices of fuel, uh, personally, I could have expected that those who are transporting the food from up country to towns like Nairobi, Nakuru, should have reduced the prices. And this is going to help those ones who are not able to buy the foods which are expensive. They now be able to buy the foods at a cheaper price. Again, the government can help reduce the taxes those people are selling food pay. I think this is another thing that can help the people of Kenya afford the foods from the markets. So, and other measures. So, if the government takes such measures, then people are going to be able to buy the foods from the market.
Good, good. All right. So I want you guys. Wekesa, are you there?
Yes.
Yes, Wekesa, maybe you can give your last thoughts in this stimulus package in Kenya and your parting shot, and then we'll finish.
Yeah, a stimulus package is a good show that the government is thinking about the common mwananchi. But however, we need a detailed implementation of the same, because most of the time things in Kenya, you see them in speeches, in media, and that is the end of the story. We want to see a detailed rollout of how they are going to reach the families they have identified. And indeed, we also witness that actually there are families in Kenya. Not everybody may be accessible to what the government will be doing, but at least we need to see that the vulnerable families are being taken care of. We need to see the handicapped, they are being taken care of because this time is a bit challenging for them to earn. We have a number of Kenyans who have been depending on like the hawkers. Most of the hawkers, their businesses have collapsed. I don't know if they have a hawkers association. I don't know whether they have been identified that people. There are people among who the government wants to help. So there are those quite people who have been doing, and those who have been also earning wages. Their jobs have stopped. We need to see the criterion in which the government is using to reach out to all Kenyans, and we will be happy. We heard that for Kenyans, that fund is around 1 billion.
Yeah.
It can be something small if it lands in the wrong hands, but it can be something big if it lands in the right hands. If
Okay.
there, you can imagine being told that we have given relief support to Gibera of 15 million, and only a few families and the rest just end up being frustrated. So without a strategy, that 1 billion is nothing.
Okay. Good. That's a good parting shot. Arwasa, your last parting shot.
Okay, thank you so much. I would like to say that uh, we need to we need to take care, especially as citizens of this country. We need to carry the responsibility of preventing the spread of the virus. And again, I would like to applaud the government for the incentives it is coming up with. I think now we will be comfortable eventually to deal with this pandemic, because if the government uh, gives the health workers uh, what will encourage them to work in these tough conditions. If it minds about the needs of the poor, then I think that is also so encouraging. That means we are talking the same language, then we can easily deal with the pandemic.
Okay. Good. Good. Yeah, so that's a good parting shot. We would like to end it there. So we want to applaud the government for all those measures. We hope going forward it will increase, or the package increases and the fund increases. So see you.